Moss, and hi, this is Miss Moss, and I'm going to give you an overview of chapter 9 and 10 for this coming up week 5 in our personal finance class. Now, chapter 9 is discussing health insurance and financial planning, also including if you get hurt, accidental insurance, different things like that. So, we're going to talk about the different types of health insurance. The thing I want you to really focus on is that you have insurance through your employer if at all possible. If you try to go out and buy insurance on your own, it is very, very costly. So if you are not working and you're getting ready to graduate and you're going to be looking for a job, one of the first things you should ask a potential employer is if they do offer health insurance. You're still going to have to pay for it. There's very, very few companies that pay for health insurance, but it would be at a reduced premium because it would be considered a group. There are several types of health insurance. You can look at, let's see, we have Blue Cross Blue Shield is one. One of them is United Healthcare. There's Kaiser Permanente. Those are the different types of insurance that you might be offered when you're looking at. Now, a couple things you want to look at when you're looking at health insurance is, first of all, how much is your yearly deductible? Most insurances is the minimum is $250, and normally it's $500 to $1,000 per person. So that means that comes out of your pocket before the insurance will ever start paying. Also, you have a copay with every type of every time you go to a doctor, you have to pay 20, 40, depending on what kind of a doctor. I know my health insurance, I have to pay a $20 deductible, but then if I go to see a specialist, it goes up to like $40. So that's something that you want to look at as your copayment. Also look at your policy to see if you have limits. You do not, most insurance policies have a maximum lifetime benefit policy. So if you go over, then you're going to have used that benefit. So those are some of the things that you should look for. There is what is called an HMO, and a HMO is called a health maintenance organization, and an HMO basically is a managed health care, and what they do is they have doctors on staff, and you have to go to the hospital or doctors that only are considered providers for them. If you go outside of that, then sometimes they won't cover it. Sometimes they'll cover it at a reduced rate. So you have your HMO. You also have your PPO, which is a preferred provider organization, and those are those doctors that will take your insurance. They have a contract with your health insurance company, and then of course it can be any doctor that you prefer to go to. You also have a POS, and that's called Point of Service Provider. And what that does is there are again certain providers that are part of that organization called a point of service. So you have your three main types of organizations, and you want to know which one that you want to sign up for. HMO is your least expensive, but you are going to be limited to the doctors that you go to. So if you find a doctor you really, really like, and they are not a HMO provider, then you cannot use them if you don't pay out of pocket. PPOs are probably the easiest ones to work with, but then of course your monthly premiums are a little bit more expensive. POS would be ranked right above HMOs and give you a little bit more flexibility. So you want to think about that when you're looking at your insurance. Another thing is, of course, there is Medicare, and I know none of you are old enough to be getting Medicare, but you may think about it for your parents if they are getting to that age. Medicare basically is a government organization for paying bills, your health insurance bills. I know working with my parents, most of the time everything was covered, but sometimes they weren't, and it was a headache really dealing with the government. So you have Medicare, you have Medicaid. Medicaid is for lower income families, and again, that's sort of on the line of Medicare. You only have certain providers that will take Medicare. Back in 2010, I believe it was, the Obamacare was enacted, or it was called the Affordable Act, and it required that every person that worked had to have health insurance. And what they did was they did kind of a lottery, and you put in, and then they would tell you which policy that you would have to get. Everybody I've heard that had that said it was a nightmare, and the policy premiums were very, very expensive. I don't know. I don't have that. You also have Social Security. That is a way of getting Medicare, because once you sign up for Social Security, then they automatically take your Medicare payment out of your Social Security payment every month. Then the book talks about things you can do to reduce your health insurance plan, and that is by staying healthy, be it eating well, exercising, and different things on that line. So that's a quick overview of chapter 9.